La la la. Check, check. Down further or
That's good.
for Gov?
I think that's good.
It's okay? Yeah. Okay. And he will adjust it if he feels it's too high. Yeah. Aloha. Thank you for the gift of your time in joining us today. Today, Governor Josh Green, MD, alongside Department of Health Director Dr. Kenneth Fink and Clinical Chief of Pediatrics for the Queen's Health Systems, Dr. Nadine Ten Sala, will address the increasing measles crisis and the need for Hawaii keiki and adults to be protected through vaccination. Without further ado, it is my privilege to introduce to you Dr. Josh Green, Governor of the State of Hawaii.
Aloha. We have some important information today to share. I have some slides here as well. And then, as you heard, we've got our experts from the Department of Health and the community to talk about the measles. So we're addressing the measles crisis in general today. And let me say, before I say anything else, please, humbly, get the MMR vaccine. That is the way to stop spread of measles. It's the way to avoid getting measles. So let's dive in. Next slide. So we have an important announcement today. The Department of Health has confirmed a case of measles in an unvaccinated child here on Oahu under the age of 5 last night. So kids got the measles. I don't want anyone to panic. There's no reason to panic, and our Department of Health is on it. We've been talking through the morning and night about what we do. This is where good public health comes in. But we do have a kid with the measles. It was a travel-related case from international travel. So DOH is investigating this case. We're working to identify those who might have been exposed to this child. And you're going to hear from our experts about how the measles works. But basically, there's an incubation period where if you're near somebody who has the measles and you're not vaccinated, you could have caught it, but you wouldn't know for a while till you get your symptoms, as much as a week or two later. And then you get all the symptoms. You're going to get fever, you're going to get rash, and so on. Our pediatrician, Nadine's going to go through this. But also, when you are infectious, when you've got that rash, and perhaps a couple days later, you would very likely have been in contact with people. And so that's what contact tracing is about. That's what we're going to be sharing today. So DOH is on top of things. This child recently returned from this international travel with their parents. They're now recovering at home. The kid's doing well by all accounts. So we send our love and prayers to them. I'm going to talk a little bit about what the measles can do to you here in a second. So right now, DOH is reaching directly to individuals who have been in known contact with this confirmed case. Flight notifications have been issued for the airline and the airports through which the confirmed child was or went as they traveled back, so people will know whether or not they're on that flight. Let me be really clear. If you're sitting near somebody with the measles and you're not vaccinated, you've got a really good chance to catch it. I mean, this stuff is infectious. So it's very important that you listen carefully to our Department of Health officials to find out if you happen to be in that lounge with them or on the plane with them or at a play date, okay? So we have issued a medical advisory, or we're doing it now to the healthcare providers statewide, and that way everyone will know to be looking out for it with their patients. You know, God willing, we won't have an outbreak, but that's the purpose of this work. Now let's go to the next slide. Okay, what are the measles? There's a picture of actually Nadine and myself treating a beautiful child in Samoa in 2019 who had a really tough case of the measles. It's a beautiful kid. That's when measles was running wild through Samoa, over 5,000 cases and 83 deaths. So it's serious. I mean, it's serious. That's why you got to fight to prevent outbreaks. So it's one of the most contagious viruses that we've got. 90% of unvaccinated people who are exposed to someone with the measles will catch it. It's in droplets. It's out there. You're gonna catch measles if you're not vaccinated and you're near someone who actually has the measles. It can spread through the air. It can linger in a room for up to 2 hours after someone leaves. Like if a little kid was sitting here for one of our ceremonies and had the measles, the next group that comes through, you could catch it. You know, again, that's why we do the contact tracing. But let me be clear, it's not just a kid's illness. It can affect adults too, and we're going to go through that. 1 out of 5 people who get the measles could end up in the hospital or will end up in the hospital. So if you have a big surge of the measles in your community, let's say you're on the neighbor islands, Nadine and I were just talking about this, and there's a big outbreak, it could overwhelm a community or a community hospital really quickly. We only have one children's hospital in our state also, so we're very mindful about how fast this could take over our community if we're not careful. Again, I'll say it now, and I'm sure everyone else can say it humbly, please be vaccinated. Please vaccinate your children. That's the way we don't spread the measles. 1 out of 20 people that get measles will get a pneumonia from the virus. It can be very tough. Those pneumonias, cause shortness of breath. They can ultimately cause fatalities. One out of about 1,000 people who get the measles will die from it. Sometimes even a little more. There have been 2 fatalities from the measles already in Texas out of a confirmed, about 500 cases. We believe there are probably a lot more cases out there that haven't been reported because a lot of people hunker down and don't share, maybe with public health officials. Maybe people feel some sense of shame. They shouldn't. It's just a virus. But be very mindful. And then also the reason I'm passionate about making sure our kids get vaccinated and not get the measles is because the complications that can occur. 1 out of 1,000 will have what's called encephalitis, which is swelling of the brain, and that can cause a lot of tragic long-term disability. So everyone's clear. We're going to try to prevent the measles from spreading. Next slide. So going back, just so everyone knows, back to about 2000, essentially measles was eliminated in the United States because we had very high rates of vaccination, so it couldn't spread. If communities are 95% or more vaccinated, it just dies out, basically. I'm simplifying, but you just don't get spread. But a lot of states have much lower rates. Sadly, we are one of them. We are one of 14 or 15 states with vaccination rates that are lower, and in rural communities, you see that. We are at 89.8% of our students that we can determine are vaccinated. So that's almost 90%, but you will not get full herd immunity at that rate. And as you've heard from me and others before, some of our schools have a much lower rate of vaccination. We'll talk about that. For perspective, in 2023, we started getting outbreaks again, or they had kind of simmered through the decades. We had 4 mainland outbreaks and 59 cases. But then people started weighing in and pushing against vaccinations and causing people to be scared about getting a vaccination. You shouldn't be scared of getting vaccinated. But when that kind of misinformation goes out, fewer and fewer people sometimes get vaccinated, and you see the numbers drop. That's what happened in Samoa, and that's what you see now. In 2024, there were 16 outbreaks across the country, 284 cases. Then 2025, just in these first few months, as of about Friday, we had 607 cases across 22 jurisdictions, 22 different states. And I think that this is actually before we put ourselves on this map. So you can see it's going up like this. And if we're not careful, you'll see thousands and thousands of cases of measles. And that will mean, significant numbers of serious complications or fatalities. Next slide. Here we go. 95% of the people need to be vaccinated. I told you our rate is 89.8%. The national average is 93%. If you look at the schools in Texas, though, and the communities in Texas, their rates were lower. Some communities, and I'm not judging, some communities vaccinate less. Some people are more isolated. But the measles doesn't discern whether you are from a Mennonite community or you're from a community in a rural part of Hawaii, or if you're on a plane and you're traveling to an international destination. If you're not vaccinated, you will catch the measles. Here at home, we have some dangerously low coverage in certain areas. There were a couple schools that were mentioned. In general, in different parts of our state, there are definitely schools under 75%. That's one way to look at it. There will absolutely be outbreaks there if we get unlucky and if a person ends up in the school with measles. So we're going to be careful. If your kids are vaccinated, they're fine. Maui had a school that was around 42%, and another one 72%. This can all be broken out by Department of Health over time if you need. But it's each of our regions. And I can tell you, when I was the doctor in Ka'u, as much as we tried, a lot of people were vaccine hesitant, and maybe they didn't get that first shot. You get the first shot when you're about a year old, second shot when you're about 5 years old. There are other times the docs will go into that you can get a shot. So I guess I'm going to basically pause there and just say this. I know that this has been a big debate. I know that some people feel passionately about getting vaccinated, and they push hard. Other people feel passionately about not getting vaccinated. They have a reason, whether it's medical or religious. We are dealing with that in a new way. I signed a new emergency rule today that if someone is asked for a religious exemption, but they still now feel they would like the measles vaccination, that will not be held against them. They will be able to maintain their religious exemption if they, in this case, want to get a measles vaccination. And the reason for that is because we're trying to be very inclusive. It's just this is a tough disease. if it spreads, and it could affect a lot of our people. That's why we're having this press conference today. So I'll pause there, and then we'll have questions after. Thank you.
Mahalo, Governor. Next, I would like to introduce the Director of the Department of Health, Dr. Kenneth Fink.
The Department of Health is expeditiously working to identify those who may have been exposed. Really want to recognize the work of state epidemiologist Dr. Sarah Kemble and her staff, who are doing this work diligently as quickly as possible. For those who have been exposed, there may be a window for them to get what we call post-exposure prophylaxis, which could be a vaccine if administered within 3 days of exposure, or perhaps immunoglobulin or antibodies within 6 days. We're reaching those folks, encouraging them to contact their healthcare provider to find out what might be appropriate for them. For folks that we are able to identify and contact directly, we are contacting them privately. There is some exposure for which the public may have been exposed, so we're making some announcements for people who may potentially have been exposed. And if they are unsure of what they should do in their vaccination status, they should contact their healthcare provider. So for individuals who were at the Honolulu airport on March 30th, between 10:50 a.m. and 2 p.m. at the sea gates, customs and baggage claim areas may have been exposed. On April 4th, between 1 p.m. and 7 p.m., those who were at the Terminal 2 departures, TSA checkpoints, and gate area for Delta Flight 309 to Atlanta, Georgia, also may have been exposed. On April 1st, between 9 a.m. and 10 a.m., at Manoa Valley District Park art class, as well as those on April 4th, between 8 a.m. and noon, who may have been at the Queens Island Urgent Care Kapahulu. Those individuals may potentially have been exposed, and if they are not up to date on their vaccination or unsure, they should contact their healthcare provider for any recommended intervention. Okay. While we have had this case reported today that was confirmed last night, the most recent cases occurred in 2023. So there are 2 cases that were confirmed in Hawaii in 2023. Our goal then, as it is now, is to prevent cases from turning into outbreaks. And the best way to prevent an outbreak has already been said, and we'll reiterate a few times, is to have a high community vaccination rate. Because measles is so infectious, 95% of the community needs to be vaccinated in order to prevent an outbreak. But that 95% is an average, and the vaccination rate may vary within certain populations or local communities. Should the case reach one of those pockets is when it can then develop into an outbreak. So we strongly are encouraging everybody who is not up to date to get vaccinated. This is not only necessary for this particular case, but it's a stark reminder for everyone who is not current with their vaccinations to talk to their healthcare provider and get up to date on their vaccines. The measles, mumps, and rubella, or MMR vaccine, is safe and effective. 1 dose is 93% effective, and 2 doses 97% at preventing measles infections. It's been around for 50 years with hundreds of millions of doses given. Vaccines, like any medicines, can have side effects. They're usually mild and go away on their own. The potential complications from measles infection is far more concerning than the possible side effects from the vaccine. I do believe that parents want to keep their kids safe. And with so much conflicting messaging, it is understandably difficult for a parent to know how to best do so. But with measles here and the risk of exposure increasing, this only increases the benefit of vaccination. And we heard with the rules that were signed by the governor today that those who have a religious exemption and are now interested in getting their child protected and also helping protect the community, they will be able to keep their religious exemption even if they get these vaccines. If your child is not vaccinated, please reconsider. Please talk to your child's healthcare provider about getting vaccinated. We are currently following routine vaccination because we have just a case. We are not in an outbreak at this time. So for routine vaccination, typically the first dose is recommended for a child age 12 to 15 months, with a second dose at 4 to 6 years. If your child has not been vaccinated, they can get their first dose and potentially the second dose 4 weeks later. Adults born before 1957 are generally considered to have immunity, and no action is recommended of them at this time. For people who were born after that, if they are certain they received one dose, then they should be considered to have immunity. If they're unsure if they have been vaccinated, they should contact their healthcare provider, or they could get another dose. Again, these are the recommendations for routine vaccination. Should there be an outbreak, these recommendations would change. Okay. People can talk to their healthcare provider about getting vaccinated. They can also go to a pharmacy. Pharmacies can vaccinate adults and children older than 3 years old if they offer those vaccines. The public can also visit our website to find more information on vaccination recommendations for dosing, clinical quotations, and updates. Those who may be at higher risk may also have different vaccine recommendations, including those who may be going on international travel. If you're going to a location where there has measles, there's other recommendations. Please talk to your healthcare provider about vaccination recommendations before international travel. Okay. This is a time where we can take action to protect ourselves, our loved ones, and our community. I strongly encourage the entire population to ensure that they're up to date with vaccinations. This will help protect, again, their loved ones and the community at large. So please take advantage of this opportunity. This is a reminder. We've had this one case with the rising rates both nationally and globally. We should not be surprised to see other cases in Hawaii. So this is a reminder and an opportunity to take action and make sure we're all up to date with our vaccinations. Mahalo.
Thank you, Dr. Fink. A note to community members and journalists covering this news conference today. The Department of Health will be issuing a news release that has the details that Dr. Fink described about location. In case you didn't catch all of them on the fly, they will be posted on the DOH website later today. Now please welcome Clinical Chief of Pediatrics for the Queens Health Systems, Dr. Nadine Ten Sal.
Good afternoon. I think the take-home message for today is it's time to pule. We have a case, and we want it to stay as a case as opposed to an epidemic. And I think ultimately the community wants to know, what can I do for myself and for my community? We've emphasized over and over that the most effective tool that we have against the measles is the vaccine. If you've had the primary series, which is the one that you get when you're 12 months old and 4 years old, you're good. Sometimes when cases are extremely large, different advice is given out. But right now, that's all you need. If you were born before 1957, as it was explained, there's a presumption that you have antibodies and that you don't need any further vaccination. If you're going international travel or going to areas that we just spoke of, some of the pockets that exist right here in the United States where you might be at increased risk, the guidelines are that at 6 months of age, an infant is allowed to take an early MMR. They will still have to do the routine series, but with a conversation with your pediatrician or healthcare provider, we can decide on whether or not that travel is risk and whether or not your infant, a vulnerable individual, would be at risk for the measles and whether or not they benefit from the early vaccine. As parents, whether or not you're looking at whether your child or someone you know may have been in the general area where this single case may have occurred, And hopefully, as we pull it together, this will not become multiple cases. You're looking for basic things. Unfortunately, 7 to 14 days after you've been exposed, you will have viral symptoms. And this will look like any other viral symptom that we ordinarily see with children. It'll be fevers. There's something called Copic spots, which is these white spots in the inside of your mouth. A rash, kind of the red pinkish eyes. The kid will have malaise. That means you're just not feeling good. All of these are the beginning. And how do you, as parents or daycare or even teachers, know whether or not you're looking at the measles? This is where you include your healthcare provider. The individual needs to be isolated as best possible, preferably at home. And it's better not to show up at the clinic to try to decide whether or not this is measles. Allow the clinic to help triage. They'll be able to talk you through the symptoms, and if they want you to come into the clinic or into the hospital area, they will arrange a safe way for the child to come in and not expose more individuals. When it comes to what you should do if you've chosen not to vaccinate, it was shared a little bit before. There's a lot of reasons people have decided not to vaccinate, and we won't go into those reasons specifically, but the point is now in our island state, what can you do to keep yourself safe and your family safe? Take advantage of the fact that there is a vaccine available. You will not lose your religious exemption status, and you can not only ensure the safety of yourself and your family, but the community as a whole. We all went through 2019. We watched on the news as Dr. Green led a team to Samoa. And I think in the back of our minds, we think we're a little bit different. We think we have a lot more resources here. And today in an excellent article, but as a fact, we are equally as vulnerable. A significant portion of our population that is unvaccinated, meaning if a case goes to those areas, are on our neighbor islands. That means they are a plane flight away from the only children's hospital we have in the state. And we don't have multiple transports to bring these children back and forth. The transports that we do have to bring children back and forth for medical reasons, they are typically full. We would be overwhelmed if they then had to transport measles cases to Oahu to go to a higher level of care. There's also a misunderstanding, as we often think of measles as a childhood illness, right? We get it. We got chickenpox. That's what our grandparents did. The issue is when the cases go up. When we get into cases that rise into the thousands, suddenly every single side effect that Dr. Green as well as Dr. Fink brought up, encephalitis, pneumonia, hearing loss, complications for pregnancy such as prematurity, as well as death, which we saw just recently in Texas, begin to occur. And if you run our numbers, if we go from a case scenario into an epidemic scenario, that will become our reality. So again, I think the take-home message is it's time for us to pull it together, for us to work as a community to make sure individually we're safe, vaccinate if you can. On a public health level, the health systems, the clinicians in the community are all speaking to one another. We're working together that if anything should occur, whether it's a single case or multiple cases, that we will do our best to care for the community in a manner that we're capable of, to keep the rate low, keep deaths at zero, and again, that this will not be something that overwhelms us. Thank you.
Mahalo, Dr. Tensal. We will now have questions from the media, and we'll need our speakers to repeat the questions because we're without our usual wireless mic. But if reporters could, speak up in this direction, it would be very helpful. Thank you so much. Governor, Doctor.
I'll jump up here and refer the questions as you guys have them.
Governor, thank you folks so much for providing all the information. I'd like some clarity. Is this child too young to be in preschool or a if so, if the child is in school, is this area to be the Manoa area? What can you share about that?
I think this is going to be for Kenny. Okay, actually, yeah, Sarah will come up, our epidemiologist. Right. So the question is specifics about the child who is under age 5. Are they in a school? Is it a concern about that school classroom and school and the area? Yes.
Hi, Sarah Kemble, State Epidemiologist for Hawaii Department of Health. So we have a whole team that is actively investigating this case and any potential exposures related to it. We've identified a couple, as Dr. Fink just read out, that we do want to notify the public of, and that's because we are unable to make sure that we can contact every single person or family involved in that setting. There are, in every measles case, some other contacts that we identify, and we do know who they are, how to reach them. We're able to reach out directly. So the main take-home point is if you're getting a call from the Department of Health and we're saying we need to reach you about a disease situation, please pick up the phone, please talk with us. We can walk you through what to do and make sure you're getting the correct guidance and keeping yourself and your family safe.
Dr. Campbell, are we able to make a comment about whether this child was in any of our schools?
This was a child under 5, so not in K-12. We in the course of our investigation, we're identifying other potential young children who may have been in contact with the case and working directly with their families, but not in a school-based setting.
And following up, the area of the island, I know Manoa was mentioned. Is it that kind of focus in the investigation, the Manoa area?
The areas we've given are specific locations where we know there was an exposure. For the reasons of we also want to make sure we're being respectful of the confidentiality of the case, we do not disclose specific address or where they reside specifically.
Emma from HPR.
Hi, Governor. Thank you for today. I'm wondering about what areas across the island are highest risk or highest vulnerability, and how accessible the MMR vaccine is.
So based on this particular case, the highest risk area would be Oahu, but keep in mind that people travel, and we have many people from the neighbor islands who come over to Oahu for the day or for several days and go back. So I think we have to be on alert and be vigilant on all islands. There is a high risk on neighbor islands in the sense that we know there are areas of neighbor islands and Oahu where there are lower pockets of coverage. So if you know that your school has low coverage, and we've talked about where you can find those links on the web, that would be a reason to have increased vigilance that perhaps you could see cases of measles in your area.
Our next question is from Kristen Concilio from KITV.
So will there be any travel restrictions if there's an outbreak, and any tips for travelers?
Boy, okay, so the question is, will there be any restrictions if we have a larger outbreak, and what advice would we give the travelers? Well, we'll be in the moment. If we start seeing more cases, we'll be updating the public, essentially in real time as we confirm cases so that we know what risk we're facing. I would say at this point, it is an isolated case. I welcome our DOH folks to weigh in further that, we're not just crossing our fingers and hoping that this doesn't happen. We're doing all the good public health that we can. That's the purpose, because the last thing we want to do is see an outbreak in a school and then have to have quarantines from school and so on. We are going to be very mindful to keep the spread as low as humanly possible. It may very well be that we just have a case or two from an outbreak like this, but it doesn't take much to get into, say, a school that had a 60% rate of vaccination. And if one got an unlucky break, you could have, several hundred children suddenly catch the measles. Then it's a whole different ball game. So let's try to keep it in this ball game, which is just only a case or two. We are very concerned about what's going on in the mainland, for example, where these outbreaks have been going up geometrically. We don't want to be a state like that. And again, there's no judging. It's just that it can get real hairy real fast. I will once again remind people what we saw in Samoa. In Samoa, the vaccination rates got really low, like 35% or something like that after the community there stopped vaccinating. And that meant that you had massive spread and people were living in close quarters, and there was no way that nation, Western Samoa, could possibly intervene. So we went and we ended up vaccinating 37,000 people in the moment. We did a 2-day vaccination program, and the measles did stop shortly thereafter, but it was too late for the already 5,000 people out of that community, which I believe the population is around 200,000 people in Western Samoa. So you can see how fast it could get. Imagine Big Island, for example. It's got about 250 or 260,000 people. If an outbreak caught on in Big Island, because some pockets, like where I was the doc in Kau, let's say, if some pockets had spread, you would see a big problem very quickly. And imagine also if you had 5,000 cases and 1 in 5 people need to be hospitalized, you would then have 1,000 hospitalizations, which could not be accommodated for really statewide. So that's why it's very important that, as you've heard before, yes, vaccination is a personal choice, but it's also a choice to protect your neighbors and your community. So it's personal, and we take personal responsibility because that's our values in Hawaii. But the question of vaccination creates its own unique challenge because you're caring for yourself and your family and your neighbors. And so that's why we humbly ask people to do this, because God forbid you see all of one of our counties light up with measles. So it's an important reminder. It's why we decided just within an hour to come and have this conversation with people, because we don't want 4 weeks or 8 weeks out to see it spreading.
Governor, we have a couple reporters covering remotely today, including Nina from the Star Advertiser. She has a question for the Department of Health. What has the response been so far to the department's emergency rules regarding the MMR vaccine and encouraging more students to get vaccinated?
We have worked very hard to make emergency changes to the administrative rules to make sure we're removing barriers to people getting vaccinated and getting vaccination for their kids. So, so far we have also sent letters out to families at schools to let them know about that change, so that we can make sure people are aware that if they do have a religious exemption and they do choose to get MMR for their child to protect them, that is not going to invalidate their religious exemption. So that's point number one. We also sent a letter out to schools in the past week to engage in educational activities, to make sure that we can offer to schools the chance for parents to ask questions and to get answers from DOH, and also to look at opportunities to provide greater access to vaccines through things like vaccination on site at schools coming up in the fall.
One more, if you wouldn't mind, please. This is from KHON, which is asking, is there any circumstance that would mandate an unvaccinated child to stay home from school or for parents to get their child vaccinated? So is there any forced vaccination?
There's no forced vaccination. If we have a child who's been exposed and is unprotected from measles, there are recommendations to quarantine at home for a certain amount of time until that window has passed. If you're able to get post-exposure prophylaxis within the required time window, then you may not need to quarantine. So this is really something that has to be determined on a case-by-case basis with the family, and that's why we're doing that direct outreach. If you do think that you or your child has been exposed and might not be protected against measles, the first recommendation is to call your healthcare provider immediately, because there's a very narrow window of time in which we can get you that post-exposure prophylaxis. If you have trouble reaching a healthcare provider, we encourage you to call our disease reporting line at the Department of Health, because we can also help to make sure that you can get access to that post-exposure prophylaxis.
Do you want to tell them what that prophylaxis means?
So that means that you can get something that will prevent you from coming down with the measles after you've been exposed. So that is two options, as Dr. Fink mentioned. One would be to actually get MMR vaccine, but it has to be given within 72 hours of your exposure. The other is to get something called immune globulin, which is basically antibodies that can be administered to you within 6 days to prevent you from becoming infected.
Thank you, Doctor.
I would comment on one other thing. Food thing. It's excellent. So, like any virus, though, if your kid is sick, we usually ask you to stay home, your child to stay home, so they don't spread common colds or other viruses. And so people, generally exercise very good common sense. So if your child has a fever or runny nose or symptoms, we encourage you again, call your healthcare provider. They'll give you good advice. They will also check to see whether you may or may not have been exposed, which is a good service that we can offer from Department of Health or our provider community. And finally, it's just good citizenship to be smart, not spreading disease. So we'll be a little extra careful. We will be providing additional updates, as we've said, if there are extra cases, because this can spread quickly into other areas. Again, we're knocking wood that it's not going to happen.
And I think we have a follow-up from Dylan Ench at the HNN.
One more question, because I know you have a hard out soon. So I want to ask, when was the last time the Trump administration provided any guidance on this? Was it reactive or dismissive of this? And also, are you concerned that your recent opposition to Robert Kennedy Jr. will impact the state's ability to get federal resources if this worsens?
Oh, no, great question. So the questions are, when's the last time we've heard from the Trump folks and the current Health and Human Services Administration about vaccinations, and is there going to be any conflict? There's definitely not going to be any conflict from our side at all. We're going to welcome all of the health support that is out there. The Department of Health and Human Services, and specifically Robert F. Kennedy Jr., have been now talking a little bit more about vaccinations. And I believe it was reported in one of the national outlets that specifically the best way to prevent catching the measles is to get the vaccine. We are focused very carefully on what we can do as a state. We have the capacity to vaccinate our people. There have been moments where I've reached out to them and I've asked humbly, or maybe even not so humbly on occasion, please don't cut our public health workforce. There have been some grants that go to the health system that were being paused. Our attorney generals are working that out with a lot of other attorney generals to try to restore COVID-era monies and monies that we're using for very important public health outreach like this. But we have the resources with our team. I will remind you, in a full outbreak, which this is not as of now, it takes an incredible lift. I mean, our entire Department of Health and then some had to deal with COVID, and that took the whole of our health systems collaboration. But we got a lot of good partners, as you know, at Kapiolani, at Queens, in the community health centers. Again, we have the resources. As of now, we've checked. We have enough vaccination, but we're going to continue to check at all times. And I did speak to the president about this, and I expressed my desire to have a good working relationship. It's just, as we healthcare providers will tell you, we have to speak up based on what we're experiencing for our people. And we are now amongst the other 22, now 23 or more states that have a case. Some are doing, not so well because the spread was very fast. There's no place for politics when it comes to healthcare, and that's why, had I had my way, Mr. Kennedy would have been something like the agriculture secretary, which I would have supported. From a health standpoint, some of us have we have certain criteria that we like to see, and we generally like to see a doctor or a nurse or a social worker in that role.
Any closing thoughts, Governor?
Oh, no, I just I'm so appreciative of the Department of Health. They're extremely well prepared for this kind of scenario after Dr. Campbell, Dr. Fink, and their teams armed up during the COVID era. It's extraordinary what their capacity is, what we learned about contact tracing, what we learned we have the capacity to do. And frankly, as what Dr. Tensala said, we have limitations to do as far as caring for individuals if a bad outbreak catches hold and we have a lot of serious disease. So everyone, this is an opportunity. We're catching this right off the bat. We didn't wait but a minute to get this information out. So please go to the Department of Health website, watch for alerts from us if there's going to be any extra concern. We will not delay in getting that concern out. But for the moment, if you feel that you may not be immune, if you're not fully vaccinated and protected, ask yourself and your family that important question: is this the time to take the opportunity to, number one, get vaccinated, and two, to take advantage of what I thought was a very smart compromise by the Director of Health, putting that rule in front of me to sign this morning, which is to say there will be no judgment. There will be no penalty if you choose to get vaccinated against your own religious beliefs. We are an accommodating state with many belief systems, and so we just care deeply about people. We don't want anyone to get sick. So again, please call your doctor if you're concerned, or your nurse if you're concerned, and we'll be here for you too.